Good afternoon on the 10th of November. Glad you're with us. You'll be getting some information just momentarily from Judge Barbara Canales, and then she'll be followed by Annette Rodriguez with our Health District. Then Dr. Byrd will be coming in and giving some information. But before he comes, Nueces County Medical Society and some other folks will be here to give you some information. So you have a full day of information today, so I'll try to be as brief as I can. But I want to remind you that tomorrow is Veterans Day, and we celebrate and recognize those that have given a lot, given their lives in many cases, but the veterans are those that are still with us, and we have an opportunity to say thanks, and we want to do that tomorrow. They're special people in our lives that have fought for our country. We got a lot of heroes, and if you haven't noticed, the flags up and down Ocean Drive, you owe it to yourself to go. You won't find that, I don't believe, anywhere else in the United States, that people that celebrate being an American, as we do in Corpus Christi, and celebrating those that have sacrificed their time and their energy and their family togetherness to go and defend our country. And we recognize them as our heroes, and then other heroes that aren't necessarily military related, but they could be first responders, moms and dads, brothers and sisters, uncles, good friends that really have impacted your life positively and made a difference. And so think about that tomorrow, and if you get a chance, go down and take a look at those flags that are sailing in the Corpus Christi breezes. Fortunately, there's enough there to make the flags all stand out and wave, and it's a beautiful sight, and one you won't see very often. So we thank the Corpus Christi Rotary Club for putting that on for us, just to remind us of what a great city we have here in Corpus Christi. But also want to remind you that as you're hearing the reports the last few days, the numbers keep ticking up. If you want to enjoy your holidays, Thanksgiving and Christmas, please pay extra attention to your protocols. And for those that are thinking they're bulletproof and that can go to restaurants or bars or start your shopping in crowded areas without your masks and paying little attention, if any, to the protocols that we recommend, it's a terrible price to pay to get the COVID. And so we just ask you to keep pressing forward, doing the right thing, follow the protocols, because the numbers right now are working against us. And you know, our best defense is you, and so you need to be on the offense and taking all the protections that you can to protect you and your loved ones and your friends. And so as these numbers look like they're ticking up, in some cases in pretty dramatic fashion, day by day, we really encourage you to double up your energies and your efforts and your focus on keeping yourself and your families free of COVID. So I'd like to call on Judge Barbara Canales to come up and share with you some things, and then she then will turn it over to Annette Rodriguez. So, Judge.
El día de hoy vamos a tener el reporte de la juez Bárbara Canales, así como la directora del Distrito de Salud y la Universidad Texas A&M. Asimismo, habrán representantes de la Sociedad Médica del Condado de Nueces. El día de mañana es el Día de Veteranos, y si no ha visto la exposición de banderas en el Parque Cole, debería de darse una vuelta. Le queremos agradecer a todos los veteranos por su dedicación a este país. También le quiero recordar, como se ha dado cuenta, que las cifras de casos positivos continúan en aumento, por lo que le pedimos continúe haciendo lo posible por evitar más casos. Use su cubrebocas y guarde su distancia cada vez que esté en público. Ahora la juez del Condado de Nueces, Bárbara Canales, nos va a dar su reporte.
Good afternoon. Barbara Canales, Nueces County Judge. I think it's been an eventful day, and I have some very important news. I was really going to focus on mental health and COVID-19 response, which I'm still going to do. And I also want to focus on our public messaging campaign that's about to launch tomorrow, but I'm going to give you at home a sneak preview here today. However, right before we came here, there was an important announcement made by Governor Greg Abbott, and I want to make sure that the highlights are also shared with you. So let's begin with the governor's announcement regarding therapeutics and vaccines. He announced today that the state of Texas has prepared allocation plans to swiftly distribute medicines and vaccines that are now available to treat COVID-19. I want you to know that between Director Rodriguez at City County Public Health, the City of Corpus Christi, Mayor McComb, and myself, Nueces County is ready to support these efforts. Here are some of the medicines and vaccines to combat COVID-19 which will be available in the near future. On Monday, of course, many of you saw that the FDA authorized the immediate use of the first medical treatment developed for people who contract COVID-19. It's an antibody drug. It's produced by Eli Lilly and Company, and although I've practiced this for about 10 times, let me just say here is my best guess. It's bamlanivimab. That one's really tough on me, Doc. Bamlanivimab. I know I can practice more with you all, but this is an important antibody drug, and it's been shown to improve the symptoms of people who contract the virus, and of course, always our goal is to prevent serious hospitalizations. The FDA says this drug is authorized for patients of high risk of progressing to severe COVID-19, including 65 and older, or those who have pre-existing medical conditions. And Eli Lilly is expected to ship approximately 80,000 doses across the country, including Texas, at no cost to our states. Lilly should have up to 1 million doses by the end of the year. So I want to caution you, I'm excited about this news, and I want you to be hopeful, but I do want you to hear me correctly. 80,000 across our entire country. So towards the end of the year, I hope to bring you better messaging about that million doses that, again, would be spread across our entire country. Remember our election. Remember how many people voted, okay? There's more people in the country than there are voters. We're going to need way more than 1 million doses. Having said that, this is a good sign. It's positive. Similar to the Eli Lilly antibody treatment, you've heard about Regeneron Pharmaceuticals, and they've also requested FDA emergency use and authorization of their antibody medical treatment to treat patients before they become seriously ill. And so the federal government has also agreed to buy hundreds of thousands of these doses. And this is obviously these new treatment drugs, and the federal government will be in charge of allocating supplies to the states. And of course, the states, particularly Texas, will in turn determine distribution to hospitals and healthcare facilities. And it's very likely that these doses will be allocated based upon their share of hospitalizations and infected patients. This makes sense, right? We want to help those who need the help the most. I'm trying to paraphrase all the announcements, but I think these are some of the highlights. Of course, would be very remiss if I did not mention that the governor also addressed the announcement by Pfizer yesterday that its COVID-19 vaccine candidate achieved success in early analysis. What does success mean? It means that it demonstrated over 90% efficacy in preventing COVID-19. And it's expected, again, some doses as early as late November. So, what is the state of Texas doing, and how am I involved in emergency management? Well, the state of Texas is preparing to distribute COVID-19 vaccines, and therefore we have partners at DSHS. That's the Department of State and Health Services. They have developed a vaccine distribution plan, and they're working with healthcare providers, including providers here in our own community, to enroll them in immunization programs that will be eligible to administer the vaccines. Get this, over 2,500 providers have already enrolled in the program in the state of Texas. And they formed an expert vaccine allocation panel to develop vaccine allocation strategies. There's probably more information that you wanted, but I really think it's important, and I haven't seen you in a while, so I want to make sure that we get as many details as possible. Now, the group that I'm involved with is TDEM. That's the Texas Division of Emergency Management. and they're prepared to assist the swift distribution of COVID-19 vaccines and treatments. So just a few weeks ago, TDM hosted what they called it a COVID-19 virtual tabletop exercise, and over 1,000 local, state, federal, and non-governmental organizational partners, including myself and Nueces County, including Director Rodriguez, came together to test the state's vaccine support plan. We were trying to understand our operational procedures, our challenges, and examine the roles and the responsibilities that Director Rodriguez will have and that I will have. And I can tell you that we are getting very organized on logistics. So once the state prepares to deliver and allocate the vaccine to us, we will then go into motion and help Director Rodriguez find all of the necessary locations to administer the vaccine and all of the important details that go with caring for the vaccine. We're going to have to care for this vaccine very, very carefully. So let me share with you what Governor Abbott shared with me in the announcement. These are his words. Swift distribution of vaccines and medical treatments will begin to heal those suffering from COVID-19, slow the spread of the virus, and aid in reducing hospitalization of Texans. As we anticipate the arrival of COVID-19 vaccines and treatments, the state of Texas is prepared to quickly distribute those medicines to Texans, get this, who voluntarily choose to use them. I think that's very important. Now, here are my words. I'm excited to see these treatments and vaccines approved and become available in the upcoming months. And I will be doing all that I can in my power to ensure we get what we need for those in need. We've done tremendous work together to improve our public health infrastructure, and I'm really proud of that. And I can tell you that we are looking to identify those most at risk, not just through age brackets or just known medical conditions like the ones you know about, diabetes, emphysema, but also looking at the social determinants of health, like economic stability, access to health care, neighborhood, environment, education, social and community context. I think this is the most exciting for those that live in the space of the medical community and public health, that we're going to go beyond the obvious and really dig down into the social determinants of health. And when we do, we will be the most prepared to tell the state of Texas, this is the allocation we need for our people. Now, I realize for Benna, I have talked so fast, but it's because I have so much to say today. Let me transition to public health messaging. On the board here today is something I'm really excited about. And this is a preview, the sneak preview of our new public health messaging campaign. This is established by the city and the county, allocating portions of their CARES Act money to establish between now and the new year all the right messaging. You see, I'm really dismayed about our numbers today. And I was dismayed about them yesterday, and I was dismayed about them the day before. And I know when the phones start ringing like crazy, we have a problem, and the phones are ringing. And so it's time to launch this campaign so that we can really understand how we can be a part of the solution. Can we make a difference and suppress these numbers? You bet you can. It's going to start with gatherings. And so we're going to focus on 3 major areas. Number 1, what can we do to help not burden our overburdened hospitals? Get the flu shot. Get the flu shot. And that's what this is about. No flu for you. Get vaccinated. A little pain for a lot of gain. Don't let the flu sneak up on you. Get a clue, fight the flu. These are going to be some of the billboards, digital media. We hope to saturate this message all over town. If we can go on to the next one. Now let's talk about our gatherings. I think gatherings are pretty much what I live for. At least that's how I grew up. Whether your gatherings are 2, 4, 20, or sometimes even grander in some big families. The joy of the holidays is going to be hampered if we are not well. And so we've focused on messages that are going to resonate with all our families. Share the moment, not the virus. Spread the joy, not the virus. Share the blessing, not the virus. Share the recipe, I like that one, not the virus. And you're going to see all of these messages again on billboards, at the mall, on bus benches and bus panels, digital media, on our websites, and through our partners all over our community. We hope to create an opportunity to spread the right message for this important time. In order to back all of this up, check out our brand new website, which goes live tomorrow with all of this messaging and a lot of important information, called noisisknows.com. noisisknows.com. Here it is. The last really significant piece of our public messaging is our COVID-19 clinic. We've worked so hard to prepare for this very moment. With 500 people suffering from COVID right now in our community, we want to make sure that they have a way to get help. And the COVID-19 clinic is free. And so I want to make certain that you guys, it says .org, and I'm getting a flash, but it was changed to .com. So now I'm wondering if it's .org or .com. We'll get back to you on that. I know it says .org, but I was told .com earlier today. So Robert will check on that for me and maybe get me some information. But it is whatever the billboard tells you it is when it gets up. At any rate, this clinic is for you. But it's not just whether you have COVID today. If you have had COVID in the past and you need medical attention, our clinic is also available for you as well. There could be some late-term effects on our COVID-19 patients, and our clinic is set up to receive you to make certain that we can assist you as well. So our COVID-19 clinic, our flu shot, and our holiday gatherings. These are our public messaging that we're unveiling between now and December 31st. I look forward to hearing from you. Tell me what you like. Tell me what you don't like. It is .com. You should always listen to your judge. noisisknows.com. Now, very important, I was saying I'd like to hear from you. Why? Because our messaging isn't going to stop. This is our first shot at it. So let me know what you think. All right. In the interest of time, I'd like to share just a little bit about mental health, but really come back to you on another day and really do a deep dive. Because when you start getting me to talk about mental health, this is what happens. You get a big, thick paper. Because our people are really suffering also during this difficult time. And over the next few weeks, I'd like to make it a priority with all of you to stress the important aspect of the coronavirus pandemic and its relationship with mental health. And so let me just highlight a few things, and then if it's all right, on our next engagement, I will make certain that I bring resources and a full plan to unveil to you about our COVID-19 response for mental health. Let me start by saying this pandemic has touched everyone, and I know that it can be very, very stressful for people in so many ways. Fear and anxiety are real, and a new disease is not necessarily a new normal. And wondering what could happen can be overwhelming, and it causes tremendous emotion in both adults and children. And I've seen this in my own family. And so public health actions like social distancing can be incredibly wonderful to save your life, but it can also make you feel isolated and lonely often. It can increase our stress and anxiety by not having our human interaction. And so while these actions are absolutely necessary to reduce the spread of COVID-19, I think that the stress that's associated with this outbreak is causing some very distinct concerns that we're seeing. And they can range from changes in sleep or eating patterns. For me, it's difficulty sleeping. I'm just constantly moving. My brain is always trying to focus on how we can get ready. And so if you have chronic health problems, you can see a worsening of those health problems. If you already are struggling with mental health condition, we can see a worsening sometimes. And of course, we always worry about the increased use of tobacco, alcohol, or any other substances. And so how we respond to stress during the COVID-19 can depend on so many different factors. And I just want you to know that there are people that have special risks, and we're going to go over that. And I'm really hoping that we together can remind each other that when we say we're in it together, It's because the operative word there is together. We will not leave you. We will get you the resources that you need. I want you at home, if you're blessed to have nobody suffering from any mental health issues or concerns, to lend a helping hand and think about ways that you can, through virtual community activism, be a part of your community's network for mental health. For our own part at the county, we are going to be hiring a behavioral health coordinator at the hospital district, and we hope to do this within the next few weeks. And we also are going to put a tremendous amount of investment in telehealth. And our opportunity for this to be successful really depends, I think, a large part upon our own willingness to accept a little help. And so I'm going to urge you all to use the resources that we've already talked about, the COVID-19 clinic. And for more information about the clinic, or if you need the clinic, I should have given you this number. It's 361-826-8019. And we can always refer you to the appropriate mental health resources as well. For now, I want to leave you with this message. Will you help us by taking care of you? Take care of your physical health and support your mental health. Take care of your body. I'm reading a book called Breath right now. I don't know if anyone has heard about this, but it's a lost art, but so it's nothing really new about it. But just taking deep breaths during the day. I run so fast, so hard, I bet you guys do too, that taking time for you is so critical during these difficult days. So take deep breaths, meditate, eat healthy, eat well-balanced meals, exercise. And I'm trying to take my own medicine when I give you this advice. Get plenty of sleep. Sleep is a weapon, and you should get plenty of sleep. Make sure you have time to unwind, connect with others. There's many ways, even in this world of social distancing, that you can connect with others and still connect with your community. And so I want you to know that there are a lot of people that want to help and reach out. In the very beginning, I said to all of you that it's going to be imperative that we take care of each other, physically, mentally, spiritually. I want us to stay strong together during this pandemic that seems that never wants to end, but it will one day. And when we look back, we'll remember that we did so by taking care of one another. That's where real mental health comes into play. So again, the next time I see you, I'm going to hopefully unveil more resources for you. For now, I want us to concentrate on the clinic, being proactive by getting our flu shot, make a family holiday gathering plan so we can all be safe. And remember, we're going to spread the joy, not the virus. Thank you so much, and I look forward to answering any questions offline for the media. And for those of you at home watching, remember, you can always reach us at the County Judge's Office, 361-888-0444. Thank you.
El gobernador Greg Abbott anunció que el estado va a distribuir la vacuna contra el COVID una vez que esté disponible. El lunes la FDA autorizó el primer tratamiento para quienes han contraído el virus, solo para pacientes que estén en mayor riesgo. La compañía farmacéutica va a entregar 80,000 dosis en todo el país sin costo. A final del año se espera que esa cifra aumente a 1 millón. Junto con ese tratamiento, ayer se anunció la vacuna que ha probado tener un éxito del 90% en eficacia y se espera contar con varias dosis a finales del mes. El Departamento de Servicios de Salud del Estado cuenta con un plan para la distribución de la vacuna en todo el Estado. Contamos también con una campaña informativa sobre la promoción de la vacuna, seguridad durante los días festivos y la clínica del COVID, así como un portal de internet nuevo de la dirección nuecesknows.com. Durante las próximas semanas quiero enfatizar la salud mental durante la pandemia, la cual ha afectado a mucha gente con estrés y ansiedad. El distanciamiento social puede afectar a una persona. Cada persona responde de manera diferente y todas las personas están en riesgo. Las personas que más pueden enfermar son las personas mayores y con problemas existentes de salud, personas que abusan de sustancias ilegales o personas sin hogar, entre otros. Si tiene preguntas sobre qué hacer si contrae el virus, la clínica está disponible y puede llamar al 826-8019. Asimismo, el Departamento de Salud cuenta con otros recursos como consejería y terapias en persona o de manera virtual. Ahora la directora del Distrito de Salud Pública, Annette Rodríguez, nos va a dar su reporte.
Thank you, Gabby. Good afternoon. Annette Rodriguez, Public Health Director. I'm going to start with the statistics today. So first slide, there you go. And so if you look over the last 2 weeks, you can see that our cases are definitely increasing from October 28th, which is to my far right, at 28 cases, all the way to today at 120 cases. Also interesting is October 31st on Halloween, you see 26 cases. People actually started celebrating, it looked like a day or two before Halloween, and you start seeing that upward trend. Next slide, please. So here we have the donut diagram, and this basically shows that out of the total number of cases in Nueces County, which is 21,938 people that have been infected with COVID-19 here locally, that we have 20,746 people that have actually recovered from this virus. So it leaves us, after you take out the number of deaths, it leaves us with 738 active cases in Nueces County currently. These active cases should be at home, isolated, as well as their contacts. Next slide. Here you see the hospitalizations. So the hospitalizations now, you can clearly see that there's an upward trend. We had been steady between 50, the upper 50s and 60 cases, for hospitalizations. And around November the 6th, we moved to 67, to 68, 77, 84, and today 94 patients are hospitalized in Nueces County from COVID-19. Next slide. So these are the ICU patients, and so if you look at the beginning of the slide, October the 28th, at 21 individuals in the ICU, and then a couple in the teens, 17 and 19, and now towards the end, 26, 30, and 28 individuals that have COVID-19 that have had to be placed in the ICU for more extensive treatment. Next slide. Today we had 2 additional deaths, one individual in their 50s and one individual in their 70s, bringing our total to 454 people that have died from COVID-19 since the beginning of this virus in March. And our condolences to the families of the individuals that they lost to the battle against COVID-19. Last slide. So this slide basically shows the bell curve of the cases from May 26th to the present. And what you see is you see a red line that goes through there, and that's the 7-day daily average. And today our 7-day daily average has increased from last week, it was in the 40s, to today it's 65 cases per day. So our cases are definitely increasing, and we need to be very careful moving forward. So the health district continues to focus our attention on our most vulnerable populations. Statistics shows that these individuals are the ones that have the most hospitalizations and fatalities. COVID-19 has not gone away. In fact, our COVID-19 positive cases continue to increase here in Nueces County, as well as in the state of Texas and nationally. We are extremely concerned with the vulnerability of our entire population going into colder weather, where more people will be heading indoors. Halloween did play a part in this increase. The incubation period for individuals that made the decision to celebrate Halloween ends this Friday. It's 2 to 14 days. This Friday will be at the end of that period. So if you are experiencing symptoms, please go on our website at cctexas.com/coronavirus under recent updates and register for our drive-through that is taking place tomorrow morning at 7:30 a.m. at 1702 Horn Road. We already have over 140 individuals that are signed up for that. Public Health is reminding the public to wear a mask and social distance anytime you're away from home. As we have learned, this novel COVID-19 affects each of us differently. and we have already lost over 450 people in Nueces County due to this virus. Let me point out some very effective practices that will help keep this virus at bay for each of you. Number one, if you are sick with any illness, stay home. Number two, if you are COVID positive, stay home. Number three, if you were exposed to a COVID positive, stay home. Number four, if you are a vulnerable population, stay home. Number five, if you are able, stay home. The only way not to get COVID-19 is by not getting exposed. Thanksgiving is right around the corner, which usually means social gatherings, shopping, and sporting events. This is a special time of the year when many people also travel to visit family and friends. Like all the celebrations that have gone before, Thanksgiving activities will have to be altered to keep everyone safe. If you choose to host Thanksgiving activities at your home, the Health District recommends that you consider the following. Think about hosting this Thanksgiving with immediate family members only. Consider virtual activities for any extended vulnerable family members or family members from out of town. Drop off plates for your loved ones outside their home in advance of the celebration. And be thoughtful this Thanksgiving. Share some extra plates with elderly, more vulnerable neighbors by dropping off plates outside of their home. As cases rise in Nueces County, remember to continue practicing safer behaviors to decrease your risk of contracting COVID-19. We are in for some trying days ahead until we receive the vaccine. We are hearing that the vaccine manufacturers are getting close to having a vaccine for distribution. But until then, we must do everything in our power to protect ourselves from getting the virus. The more citizens that get infected, the more our vulnerable populations are at risk for getting the virus and being placed in harm's way. Let's find safe and enjoyable ways to celebrate this Thanksgiving so that over the next few weeks, our numbers do not continue to climb. Our number one goal for public health continues to be to save lives. Stay healthy, stay strong, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 122 casos confirmados por el coronavirus, 15 casos probables, haciendo un total de 137 casos. 20.746 pacientes se han recuperado por completo, 94 continúan en el hospital, 28 están en la unidad de cuidados intensivos, 738 son casos aún activos. El día de hoy se reportan 2 fallecimientos. A la fecha, los fallecimientos totalizan 454 personas. El promedio de casos diarios basado en los últimos 7 días es de 65. El Distrito de Salud continúa enfocando nuestra atención en nuestra población más vulnerable. Las estadísticas muestran que estas personas son las que tienen más hospitalizaciones y muertes. Los casos positivos por COVID-19 continúan en aumento. A nivel local y nacional, el clima frío pudiera aumentar aún más los casos. El Día de Brujas jugó un papel importante en este aumento. Si usted cuenta con síntomas, puede registrarse a la dirección www.cctejas.com/coronavirus. El día de mañana habrá una toma móvil de especímenes. El Distrito de Salud le recuerda tomar todas las precauciones de salubridad para evitar un contagio. Ya son más de 450 los residentes del condado de Nueces que han fallecido debido al virus. Se le pide quedarse en casa si está enfermo, si es COVID positivo, si estuvo expuesto a un caso positivo, si es vulnerable, y ya que la única forma de no contraer el COVID-19 es no exponiéndose. El Día de Acción de Gracias también ya está a la vuelta de la esquina y le sugerimos varias recomendaciones. Celebre este día solo con familiares directos. Considere actividades virtuales con otros miembros de su familia no directa. Entregue comida a sus seres queridos fuera de su casa antes de la celebración. Sea considerado con los demás. A medida que los casos del condado continúen en aumento, es importante seguir tomando precauciones, ya que aún no se recibe una vacuna que prevenga contraer el virus.
Maybe 2 arms length. There you go. All right. So, good afternoon. I'm Dr. Marita Rafael, pediatric emergency physician, and president of the Nueces County Medical Society. Thank you for the invitation to this event. We, the doctors of the Coastal Bend, Corpus Christi area, want to join the city, the county, other stakeholders, and leaders in the community in amplifying a message of great importance, one that we believe each person in the Coastal Bend must hear before the holidays. Listen to this. There is no evidence to indicate, I think next slide. Okay. There is no evidence to indicate that our region has yet achieved widespread population protection or herd immunity to COVID-19. Next. A person contracts the virus by exposure to another person or persons with the virus. Small gatherings are an important vehicle by which the virus spreads. And as we all know, the virus is deadly to many people. In fact, some family gatherings have been reported wherein multiple persons contracted the virus and some of them died from their infection. Therefore, we, the physicians of the Coastal Bend, are urging you either to cancel altogether, postpone, or significantly change your plans for the holidays. If you, for example, had planned on hosting holiday office parties or extended family gatherings like family reunions, or even inviting people outside your household and there's close contact, please refrain from doing that. This year is not a normal year. This is in no way business as usual. For example, Dr. Anthony Fauci of NIH has canceled his plans for Thanksgiving to avoid spreading or contracting COVID-19. Now, even if you decide not to cancel or postpone your holiday greetings, there are definitely safer ways to plan and host gatherings. I know that Annette has already alluded some of the ways to keep gathering, in a safe manner, but repetition, hopefully we will hear it. Some of the tips are having the gathering outdoor. Now, this would give ample distance, 2 arms length, 6 feet away from each other, for your guests to be able to get together safely. Seating guests from the same household together, and then maybe separating another table for other household. Wearing masks. Socially distancing, as I alluded on the first item. Refraining from hugs and kisses. I think we have already modified our ways. We've done, elbow rub, namaste, air hug. But let's be consistent. Let's keep on doing it. Having hand sanitizer available in the area, but hand washing would still be preferable for about 20 seconds. Serving guests at their tables rather than having a buffet-style single-serving area. And moving the event to Zoom or other virtual platform, or even doing it hybrid. Bring the food for your elderly loved ones, and then when the household eats, invite them via Zoom, and you all eat together, and you still eat the same food and side dishes. So anyway, I know that some of my colleagues would have more tips. It will, longer, more tips to say, but let's skip the basic. Now, the decision decisions you make this holiday season will, for some of you, result in life or death for yourselves or others. This may sound grim, but it can happen, and it has happened. We don't want you or I to be statistics. As doctors in the Coastal Bend, we take our responsibility seriously to inform our patients and the community about risks to their health and safety and what they can do to save their lives. While this message is one of temporary sacrifice, it is one of hope. Hope that we are making progress in understanding, treating, and fighting this virus. You know, I'm so happy to hear about the monoclonal antibody being approved and ready for distribution. So this is hope. Now, as for now, we must do whatever it takes to ensure we survive COVID-19 pandemic and return to our normal Coastal Bend lifestyle once again someday. And I say it with a smile because there's hope. Thank you for your attention. The next speaker would be Dr. Bird with TAMUK, Modeling Task Force Team. Thank you.
La doctora Morita Rafael, presidenta de la Sociedad Médica del Condado de Nueces, indicó que no existe evidencia de inmunidad colectiva en el área de la costa. Las pequeñas reuniones pueden propagar el virus y causar fallecimientos. Esta temporada de vacaciones del 2020 están recomendando a los médicos de nuestra área que posponga, cancele o modifique significativamente sus planes para las reuniones. Las formas más seguras de una reunión es posponerla hasta que la vacuna esté disponible, celebrar las reuniones al aire libre, contar con mesas separadas para cada hogar, utilizar cubrebocas, practicar el distanciamiento social, evitar abrazos, y las decisiones que tomen esta temporada navideña para algunos pudiera significar una diferencia entre la vida y la muerte. Ahora el doctor Chris Bird con Texas A&M nos va a dar su reporte.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID Task Force for the Coastal Bend area. We have two objectives on the task force. The first is to address your concerns about COVID-19 and the interventions that are taking place to combat the spread of COVID-19 in the Coastal Bend, and two, to enable evidence-based decision-making. And I think that's particularly relevant today with what we're going to present, and it's really enabling you in the community to make evidence-based decisions on how to celebrate your Thanksgiving holiday and how to act in the next few weeks coming up. There's a variety of interventions that are in place. Stay home if you can, social distance, wear face coverings, obviously self-isolate if you're symptomatic, or if you're exposed to somebody who's been symptomatic until you talk to your doctors. And there's been a variety of school restrictions in place. I'm not sure what happened to the slides this week, but, and also we're at Open Texas Phase 3, or the equivalent of Open Texas Phase 3 right now, where businesses are at 75% capacity and bars are at 50% capacity. And this is the same level of openness as when we went into an outbreak in the summer that was quite large. So I'm going to skip over these slides. I'm going to go to the ones that matter because our time is limited here. Let's start with this one. In the Coastal Bend, each one of these lines represents the new cases per day for each of the 12 counties. You can see generally they're going up. Jim Wells did come down off of its pretty high spike there, but Nueces has been trending upwards. San Patricio trending upwards, Duval, B, Clayburgh, Aransas, etc. Everything's going up right now. And this data, for what it's worth, it doesn't include these last 2 days of 100 some odd cases because we're a couple days behind because we have to line up with the state to have all the data across all the different counties. So given that, and we don't have the last 2 days of 100 some odd cases in the Coastal Bend, The transmission rate we estimate is about 1.8. It's probably higher than that when we add in those last 2 days of 100 cases. Realize that the last time we had triple digits number of new cases in a day was 73 days ago. So that's about 2.5 months. And so we're definitely going in the wrong direction here. This 1.8, it might not be as big as the 3.2 that we estimate we were at in June. But it's more than big enough to send us into an outbreak that was bigger than the one in June. This is what we're projecting right now based upon that transmission rate of 1.8, if everything just carries forward the way that it has in the past. The Open Texas 1.5 intervention, which is the closing of bars and rolling back businesses from 75% to 50% capacity, is estimated to occur somewhere around the second week of December. December 14th, to be exact, is our projection right now for that day. It's about a week later than we predicted last week, because last week our transmission rate that we estimated was 1.9. I want to remind everybody that the transmission rate, this is how many people on average get sick from another person who had COVID. So if somebody gets COVID and they get 2 additional people sick, that's an RT of 2.0, so 1.9, 1.8, it's a little bit below that. And this is really high, and it leads to an outbreak that's as big as or even a little bit bigger than the one that we saw in the summer. So I want everybody to pay close attention. In Hurricane Harvey, it was a Category 4 hurricane, and 68 people died as a direct result of that hurricane in the coastal bend. Now back here, this is the equivalent of, say, Category 5 hurricane, or maybe bigger, that hits the whole coastal bend all at the same time. And over 700 people died in the coastal bend from this outbreak, which is the equivalent of, say, a Category 5 hurricane. Now here's the difference. We've got another Category 5 hurricane. It's in the Gulf, metaphorically, and it's pointed straight at the coastal bend. We can control how big this hurricane is, how big this outbreak is right now. We're early enough right now that if our behaviors change and this transmission rate changes from 1.8 to something lower, we can reduce how big the outbreak is. We can reduce how many people die. And you might think, well, you know, I don't really want to do that. I'm tired of COVID. But think about it like a hurricane. If you could control the strength of the hurricane that's hitting the coast, I think that we would do it. Think about how much time you spent after Hurricane Harvey helping other people, helping yourselves clean up the mess and rebuild the houses and all those different things that you did. It was months of time that was spent. We can avoid a lot of that right now by changing our behavior. So I think that's a good way to think about this. There's a metaphorical Category 5 hurricane in the Gulf pointed at us. This is what it's going to look like. We're looking at another 700 or more people dead in the coastal bend from COVID-19, and we want to try to avoid that. And the worst part of it is it's hitting right around Christmas at its peak. And so you might think, well, I'm not going to let the coronavirus get in the way of my Thanksgiving Day plans, but that's exactly what coronavirus wants you to do. Coronavirus loves gatherings more than you do. They love when you take your, it loves when you take your mask off. That's how it gets transmitted. So think about that when you're making your plans. Now, in terms of hospitalizations, we're looking at a peak a little bit later, around December 27th, and it's a little bit higher than it was last time in the summer. And this is projected right now, assuming that the transmission rate stays at 1.8. But if we change that, if we change our behavior, spend less time in big box stores and restaurants, and I'm pointing those out because in El Paso, where they've had 3,000 new cases in a day, 2,000 new cases in a day over the past week, 50% of the people that are getting COVID, they think they're getting it from restaurants and big box stores. If you're inside for a long time, the virus is airborne. It's aerosolized. It doesn't drop to the ground 6 feet away from you. And it doesn't matter if you're not spending 15 minutes directly next to somebody else. If you're inside in a store with hundreds of people, then that's a prime breeding ground for COVID-19. You want to try to avoid those types of things as much as you can. These are the types of outbreaks that we don't want to see. And I'm not projecting that we will see anything like what we're seeing right now in Amarillo, Lubbock, and El Paso here in the coastal bend. We're looking at something maybe more on the scale of what we had in the summer, but this is how bad it can get with the interventions in place the way they are now with the 15% hospitalizations. Those same interventions and triggers that govern us allowed these outbreaks to happen in other parts of Texas. And so it's something that you really want to pay attention to. All right, I'm going to skip over this. We don't have a lot of time. Fatalities, we're at 736 right now in the coastal bend. There were 4 fatalities in the coastal bend before the June outbreak, so that's 732 fatalities from that summer outbreak, which was like a Category 5 hurricane. Now, this is a new graph that we're showing here, and the thing that I want you to pay attention to is this is fatalities per 10,000. I'm not sure what happened to the slides this week. They're kind of like not scaled correctly, but fatalities per 10,000, so it's fatalities per capita. And I thought I saw something in the data where you were more likely to die from COVID if you were outside a Nueces than if you were inside a Nueces. We ran the stats, and that's true. It's a statistically significant result that more people per capita are dying outside of Nueces County from COVID-19 than inside of Nueces County. Really, it's being driven by Brooks and Refugio, but there's several other counties that have a higher fatality rate per capita from COVID-19 than here in Nueces. So here's the take-home message. Just because you're not in Nueces, just because you're not in downtown Corpus Christi or down along the SPID, doesn't mean that you're immune from the effects of COVID-19. And actually, at least when it comes to fatalities, you might be more susceptible to some of the worst outcomes, possibly because there might not be as much hospital care near you, or you're more likely to say, well, I'm just going to ride this out at home. But don't do that. If you're really sick, you should definitely call your doctor and go to the hospital if they tell you to. Last thing. We don't see a lot of patterns in the cell phone data. It's supposed to tell us what's happening in the future, but here's one pattern that we can see. The foot traffic at high school sporting event venues is approaching what it was in 2019, and that's a substantial increase. You can see we're up near 100% of normal. So what this means is these are, we have the cell phone data focused on ball fields where football games occur from 5 o'clock to 9 o'clock, 7 days a week. And in those locations, we're seeing a pretty big increase in the amount of people there. So if you're at a ball game and you're outside, just because you're outside doesn't mean you can't get COVID. Social distance, stay apart, wear a mask. That's going to help you not spread COVID at those venues. The other thing that I thought was somewhat interesting was for essential versus non-essential gatherings. The blue is essential. The ones that aren't blue, non-essential. That we're actually seeing a very, very slight downturn in foot traffic to restaurants and bars. But we're also seeing that grocery stores and home improvement stores, which used to be the #1 foot traffic spot because they're essential, they're now down below gaming in terms of percentage of normal, and malls have risen above home improvement stores, at least for the moment. Movie theaters have been fairly level. And again, I apologize for whatever happened to the figures here. We'll try to make sure it doesn't happen next week. But ultimately, we can't point to any one thing really in this cell phone data. And what it looks like is it's more decisions that are getting made by us that you can't detect with a cell phone, such as wearing your mask or avoiding gatherings at other people's houses and things like that. And Halloween, for example, the cell phone data is not going to pick up Halloween and the effect that that had. So in summary, the transmission rate is high. A large outbreak is predicted. We predicted it last week. We have a whole new week of data. We're still predicting it. And the cases went up big time this week. We haven't seen triple-digit cases in one day in Nueces County for 2.5 months until yesterday. Now we have 2 days in a row of it. Hospitalizations are predicted to begin increasing. We already see that happening in Nueces County itself. When you look at the coastal bend overall, you don't see that same trend yet. So it's kind of being offset by a decrease, apparently, in cases in other parts of the coastal bend. And there's more fatalities per capita outside Nueces than inside a Nueces. So just because you're away from the big city, if you will, it doesn't mean you're immune to the effects of COVID. You should even pay more attention because you might be farther away from hospital care. Lastly, what can you do? We've had great presentations on what you can do, but one more time, wear your face mask, social distance, do takeout and curbside. This is the thing that I don't get. I love curbside. I love takeout. I wish I had this my whole life. I never want to go into a store again, ever. It's like I'm rich and famous. And, you think like Donald Trump has ever gone into a grocery store? No way, right? So you can be like the rich and famous and just, order your food online. Maybe you get your kids to do it for you. Then, you don't have to worry about it. And you drive up and they bring it out to your car. It's amazing. And last thing, avoid gatherings, especially indoors. There's a lot of great advice out there for Thanksgiving. There'll be more time to message on Thanksgiving, so I will leave it at that, and we'll go to a translation.
Las recomendaciones no farmacéuticas continúan vigentes. Todos los casos en el área de la costa continúan en aumento. De acuerdo a las estadísticas, el radio de transmisión se encuentra en 1.8, posiblemente mayor, ya que los casos nuevos han aumentado localmente a 3 dígitos, por primera ocasión en más de 70 días. Si las cifras continúan aumentando, los fallecimientos también van a aumentar, hasta 700 casos nuevos en nuestra área, así está pronosticado. El no seguir las recomendaciones pudiera ocasionar tener un brote como lo tuvimos durante el verano. Actualmente, el número de fallecimientos es de 736 personas en el área de la costa, la cual cuenta con 12 condados. Recuerde, utilice su cubrebocas, practique el distanciamiento social y también evite ir a la tienda en persona y opte por comprar con entrega a la banqueta.
And we'll take a few questions from Facebook Live. And usually these questions are better answered by Annette Rodriguez, so we'll have her come up. He's pointing at me.
Yeah. We don't have very many questions today, but we do have one for you. We'd like to have your opinion about, is it safe to go back to church indoors in person? What's your opinion?
It's no safer to go back to church indoors in person than it is to go to any other place where a lot of people are gathering indoors in person. There's nothing that would particularly protect you in a church that wouldn't be occurring, somewhere else.
And this one maybe Annette could answer. When does COVID-19 become COVID-20?
When does COVID-19 become COVID-20? I don't believe that it changes its name because it occurred, the novel virus, in 2019, so it'll stay COVID-19.
I agree with that answer. And if we were to get a COVID-20, it would because there would be a new novel coronavirus, and then it would become number 20. Most likely, it would not turn into a global pandemic like this one has.
And then another question about a drive-through clinic. When will there be another one?
So the health district will be having their drive-through tomorrow at 7:30 in the morning, and people can register themselves online at www.cctexas.com/coronavirus under recent updates. They can self-register themselves and family members and go through at 7:30 at 1702 Horn Road.
And the Facebook users would like to thank the doctors for giving their presentation and their opinions on how to handle the upcoming holidays. Thank you.
Thank you. Are there other questions? So without any other questions, we too want to thank Nueces County Medical Society and all of the Coastal Bend physicians for coming and talking to the citizens. We think it's very important. Appreciate it. Thank you, Dr. Bird, and we will see you all next Tuesday at 5 p.m. Thank you.